Can you identify the instrument? The first instrument.
So giggly saw.
So where it is used?
So for amputation, sir.
So it is not for amputation. Any bony resection it is being used.
Okay, sir.
So this, what is this? These things. What are this? This is the cutting wire and these are the handles. So you use this cutting wire and with the handles. So what are the surgery where you use it? What are the bones you can cut with a giggly saw?
So tibia,
Can you cut?
fibula.
Yeah. The limb bones you can cut. Can you cut a vertebra?
No, sir.
Any other bone in the body which you cut with this?
The upper limb bones.
Okay, the limb bones is okay. Anything else? Abdomen, thorax, head, neck, anywhere?
Not sure, sir.
Mandible. Mandible is commonly cut with this English method. So what you can see in the second picture, which is the alternative to the giggly saw.
No, sir.
This is the electronic saw. This is commonly known as Monman saw. It's a running name. So what it helps, so whenever you are doing this marginal mandibulectomies, in that case you have to properly saucerize the mandible. So this is the mandible. I'm planning for a marginal mandibulectomy. What you have to properly saucerize. That means the cut should not be in the acute angles. Okay. So for that, for precise cut, you can take the help of this electronic saw. So that, because giggly saw, if you cut, it will be angle cut. But if you want to cut with the obtuse angle or saucerize lesion, this is defect, then you have to use this electronic saw. And these cuts are also very precise. Also, if you want to do just a mandibulotomy, just want to divide the mandible and get the approach to the floor of mouth or oropharynx, for that also, this electronic saw works better. And you can then oppose them with the screw. So in many dental procedures, like maxillofacial surgeries, this saw is used. For malignant cancer surgery, especially for marginal mandibulectomy, it has a very great advantage over the giggly saw. Why you need to saucerize the marginal mandibulectomy? So if you keep the mandible, cut the mandible in an acute angle, so what will happen? The blood supply to this part of the angles will be lost. And if you radiate this patient afterwards with this devascularized bone, what complication will be there?
Necrosis, radiation associated with osteonecrosis.
Called osteoradionecrosis. That is why you always try to use a Monman saw or electronic saw whenever you are going for a marginal mandible.
So what is it called, sir? Can you please write, sir?
Osteoradionecrosis.
No, sir, the name of the saw, sir, actually.
It's an electronic saw. Commonly, it comes in a brand which is called a Monman saw also. Indian brand. It is commonly available in this. It's an electronic saw. Just to mention it as an electronic saw. It's a proper, like a saw you see in those movies, violent movies. So you can cut the bone with it's a very electronic motor is there inside this handle. So it's cut very precisely, and you can plan your resection accordingly.
All right, sir. Thank you.
So we'll end up this session. Any further?